Okay, so I'm Matt Meiselish. I'm a MD PhD student at Yale. During my PhD years, I've had the opportunity to be a primary care provider in the Yale Primary Care Center over the course of 2 years and have gotten to know patients really well during that time. And one of those patients who I saw consistently is named Ben, or we'll call him Ben. And to me, his story sort of epitomizes the way in which patients fall through the cracks in our system and the consequences for their healthcare. So he would come to see us regularly and would pay out of pocket to come to the primary care clinic. Because he didn't have health insurance, he wasn't able to afford a lot of the things that we wanted to do for him. As just one example of that, he had a mass on his left side, and we wanted to biopsy it or get imaging to make sure that it wasn't cancer. We thought that it was benign, but the right thing to do for him was to make sure that this was actually not going to turn into cancer and become a really major health risk for him. And we weren't able to do that because he didn't have insurance and he couldn't afford the imaging. And there were a series of instances with him and with other patients who were in the same situation where we weren't able to provide the kind of care that we should be providing for our patients. Ben represents, for me, an entire class of patients who we may or may not see in our healthcare system, who make enough money, working class people who make enough money that they don't qualify for Husky, but don't make enough money to pay for health insurance, to pay for private health insurance. And this bill can be a life-saving policy intervention for those individuals and who need a public option that can fill that gap and that can give them an avenue to quality healthcare.